This is Leslie Ziegler, and I'm coming to you live from the Digital Health Summer Summit at UCSF. And I am sitting here with the lovely Sarah Jane Militello. Hi.
Hi, Leslie. How are you?
Doing well. And you just came off stage talking about some really important stuff. Would love to hear about your role and what you're working on.
Oh, sure. I'm directing operations at the UCSF Samsung Digital Health Innovation Lab, and we are accelerating the validation, commercialization of technology.
Fantastic. What specific areas?
Well, particularly since we are partnered with Samsung, we are really focused on consumer-related devices. But, the focus is really to try and understand whether these devices are operating the way we think they operate, whether they're really doing what they need to do for people, and whether they offer value ultimately to their health.
Are there any projects that have been particularly successful so far that you can point to?
The first few projects we've done have been really focused on Samsung's particular technologies. They have developed an open test bed for sensors, and of course these sensors are being used in all the mobile health devices, so that's kind of a good thing to do to sort of see how that works. The data is then being uploaded to really a software platform that they have that is really device agnostic, that information can come up to the platform, and the hope is the kinds of things we can study will really allow us to both discover new things as well as really validate that things perform the way we think.
Yeah, it must be fascinating, as an academic institution to work with a device manufacturer, hardware manufacturer that is not a Medtronic or someone who is just entrenched in, in the health world. This has got to be something new for them. How would you say, the relationship is working in terms of, what you're teaching them and what they're teaching you?
I would say it's a unique partnership, truly. We physically occupy a lab here on the Mission Bay campus, and on one side of the lab are our UCSF researchers, on the other side are the Samsung developers, and sometimes we let them, cross across and work with each other. But they are learning from each other, and it is a really interesting process to see, sort of a medical research mentality sort of blend with a consumer company. But after all, I think when you have all these wonderful discoveries and you want them to reach people and to be used, they really need to leave the lab and get into the market.
Yeah. So, for those who couldn't make it to the summit today, you were up on stage, you guys talked a lot about, a lot of things, but what do you think is the number one kind of takeaway?
We really talked about the worth of technology, and I think particularly in digital health technology and mobile health, a lot of manufacturers' abilities to get people to not just buy their products but use them will really in the end be what's worth it to them. And I think that's a really important thing for all of us in terms of what we do, validating that they do what they say. This is what is really going to help people when they buy them.
Great. Anything you're really excited about in 2015? The small amount that remains. Can't believe how fast this year is going.
It has gone really fast, actually. Well, I think we're looking forward to now inviting other players to come in to have technology validated. We look to people like investors who may be looking at a new sensor company, would like to have it validated. We're looking forward to maybe taking on those kinds of projects in the coming.
Fantastic. So if you're out there, guys, here's how you can get in touch. How can they get in touch?
They can find us here at UCSF Samsung Digital Health Innovation Lab.
Is there a Twitter or any social media magical things happening?
Well, as with all universities, we're all in the acronym world, but the Center for Digital Health Technology is probably where they can find us.
Well, thank you so much for taking the time to chat. Thanks
Leslie.